What are potential risks and complications of BMAC and PRP injections?
The cool thing about bone marrow and PRP is that we talked about with surgery, there's a risk of infection. Now, yes, putting a needle in somebody, whether it's an immunization, a shot, anything, there's always a slight risk of infection, but it's very, 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 very low, way less than 1%. And so the risk of infection with the surgery, if you get antibiotics, is about 1%. The other cool thing is that bone marrow and PRP both have antibacterial and antimicrobial properties, so they even lessen the risk of infection by themselves, just in and of themselves. Some bruising and maybe a little bit of bleeding, very low risk. Now, wherever we're sticking a needle into a vein or into a bone, I mean, if you put it in the wrong spot, you can damage a nerve or a blood vessel or things like that. But that's very, very rare as opposed to a surgery, which is a lot bigger area for potential for injury. And even that's pretty low. Anytime you stick a needle in someone, could the needle break or break off? Or, I mean, I've never seen that happen, but things like that can happen. So there are some risks. I think the most common risks are really just some pain from getting a needle stuck in you, but it's not even close to as painful as a surgery. And we numb the area up, but you still have to get a needle to numb it up. And then maybe bruising, a little bruising or bleeding. But even that is very rare. I mean, those are kind of the two main risks. Not that there's not some other very, very less common risks.